We're at the Sacred Stream Center with Isa Gucciardi, the founding director of the Foundation of the Sacred Stream, and the creator of the therapeutic model, Depth Hypnosis. And we're here to talk to Isa today about Depth Hypnosis. So Isa, can you tell me a little about this model that you created?
Depth Hypnosis is a process of self-transformation. It is a process of understanding oneself at deep levels. It's a way of understanding how one's problems or one's symptoms of imbalance may be showing us about who we are and offering us a way of actually sitting with the symptoms as a teacher so that we can find our way back to wholeness by listening to the issues at hand.
And how does it differ from other counseling models?
One of the primary ways in which depth hypnosis differs is that in depth hypnosis, we're really looking at the therapeutic process as a process of self-discovery and discovery of the other by the practitioner. There's no idea that the practitioner has it all figured out and that there is a label that can be placed on the issue so that the label makes the issue knowable. It truly is a process of moving into the unknown, and the unknown is the deeper reaches of the self, and it's a very exciting process, and it is therefore very alive, because even though it takes a little bit of time to get used to being in the unknown and being in a constant state of discovery, what happens is that the therapeutic process is ever deepening with this method of inquiry that we bring with depth hypnosis. And I think that this is a little bit different than other therapeutic models which seek to create a conceptual model, place a diagnosis on it or a label on it, which of course is very helpful, because a lot of times if you don't know what you're dealing with, you don't know how to address it, right? And I think it is important to try to understand what is happening. I had someone in my office the other day say they really felt that they could not heal until they understood what had happened to them. And I totally understand that. And the issue is, however, that we can't totally understand what has happened to us conceptually only, not only on the conceptual level. There are many different levels to the self that are sometimes excluded from other therapeutic models. So although they may provide wonderful tools at the level that they're working, they are limited, and that they don't include these farther reaches of the self as part of the discovery process of what might be going on with someone.
And what are some of the ways that depth hypnosis accesses these further reaches?
Well, of course, one of the main tools in depth hypnosis is the use of the altered state. And we work with the altered state, again, to help a person move beyond what they know on a conceptual or rational level. And of course, the conscious mind is a very helpful tool for navigating the world. You know, the awake, problem-solving state of mind that most of us are in all day long is very, very important for being able to navigate the world. One of the things the conscious mind does is that it blocks out information that it thinks might interrupt its ability to make sense of the world or to navigate properly. So if we've had some kind of a trauma or some kind of an experience that has been disruptive to us, the conscious mind will generally seek some kind of method of corralling that experience and the effects of that experience in order not to disrupt the conscious mind's ability to organize reality. However, when you're trying to understand the deeper roots of a presenting symptom, you may have to go beyond the conscious mind in order to find the roots of the problem. And those roots may lie in the emotional level of the self, they may lie on the spirit level of the self, or they may lie actually deep within the physical body. So it's important to recognize that the altered state is actually like a boat where you can navigate through these other levels of being without the usual blocks or defenses that the conscious mind might put up in order to protect the person from being disorganized. You actually have to allow yourself to become a bit disorganized in order to be able to heal sometimes. And of course, depth hypnosis has a lot of processes that help you as you feel a little bit disorganized. And one of the primary ways in which that disorganization might be supported is through connection with the part of the self that has only the highest good as its sole intent. This is the phrase that we use to address this part of the self that is wise, that is compassionate, and actually that some people feel that they may not have a strong connection with. But when they enter into the altered state and when they are guided with the methods of guided meditation, it's not exactly a guided meditation because the meditation is designed to help the person evoke their own imagery rather than plug into someone else's imagery when they're in an altered state, the way most guided meditation does. So they have this inner process where they are discovering this part of themselves that is wise and that is compassionate and that knows about the nature of healing. So as the person is moving past the conscious mind's blocks into the altered state, this part of the self is there greeting them, holding them, guiding them, so that they can allow themselves to become disorganized a little bit in the same way that they were disorganized when the original trauma or the original wounding happened, which is, of course, the experience that is driving the presenting symptoms. So we have many methods within depth hypnosis that allow for the safe exploration of wounding, of trauma, of any kind of generating cause that is creating difficulty in the person's life. And the use of the altered state is one of the primary ways in which those tools and resources are accessed.
Mm-hmm. Now, when you say the part of the self that has only the highest good of that person, are we talking about the higher self or something else? I personally would call this part of the self the higher self. I would also call it guidance that may be transcendent beyond the self. I think that there's a lot of different ways of perceiving this part of the self, including conceiving of it as something that is actually arising outside of the self. But it is for those people who understand the concept of the higher self, this is one good way to consider thinking about this part of the self that has only the highest good as its sole intent. Mm-hmm. Now, I've heard you talk about it a little bit previously, and it was interesting because you described it as everyone has their own relationship to it. So you have this very open, non-dogmatic approach to people engaging with this part of themselves and defining it for themselves. And I thought that was, it seems really helpful. What's your take on that?
Well, I think that, I'm glad you're kind of exploring here a bit, because depth hypnosis actually opens a very deep well of experience of spirit, ultimately. And it's one of the reasons why people stay with the depth hypnosis process beyond the place where their symptoms are relieved. Because, as I said, you're going deep within the self, you're discovering aspects of yourself, and when you discover the experience of the higher self, when you experience this part of the self that is compassionate, that is stable, you want to develop a relationship with it, a deeper relationship with it. And in some models, one might say this is an aspect of the self that is connected to divinity, and thereby you can explore your own relationship to divinity in your own terms, in your own way. And this in and of itself is very healing, especially for people who are suffering because they have become disconnected from their sense of self and their sense of connection with the divine. And one of the most marvelous things that I enjoy doing as a depth hypnosis practitioner is to help people who have been wounded in this place where their relationship to the divine has been harmed, either because of a sense of deception by an orthodox spiritual or religious practice, or because they have felt that they have to be more scientific and they have to kind of get with it and grow up and, you know, forget about this numinous part of themselves that was so enlivening when they were children. And for me as a practitioner, I actually specialize in what Christina Groff calls spiritual emergency. And I can't tell you what a joy it is for me to be able to help people connect back with this part of themselves that is connected with the divine and which they understand in their own way, and they find their path back to their connection with the divine with their own definitions, with no proselytization, and that relationship with this deeper part of the self, which again in some models might be thought of as the relationship with spirit, is in and of itself highly healing. And there is a lot of work that can go beyond that connection once it's made into the deeper exploration of one's relationship to this mystery that we are all living.
What inspired you to create depth hypnosis?
Well, you know, as a child, I was very interested in trying to understand why the people around me were so unhappy and why everything in nature was so happy in a child's terms, right? So, you know, it started pretty early. I kept thinking, what can we do to bring this balance and this happiness that I experience when I'm here in nature with the animals and the birds and the wind? You know, why can't we bring this happiness to people who don't seem to be too happy? Because I didn't know anybody who was happy when I was little. Everybody seemed pretty upset about something. And I think that has increased. You know, I think people have become more stressed and more upset and more insecure and more afraid in their everyday lives. And so as time has gone by, as the world has become so complex, as we've been developing into this sort of calamity that we're all living, it was a question that I had really early on. How do we do this? So I was always looking around, trying to figure out. I spent most of my youth digging around in different places and different fields of study: religion, culture, international relations, anthropology. I was digging around trying to find where can we find a model that is going to bring this happiness to humans. But the truth is, I didn't even look in psychology at first, because when I went to study psychology, they wanted me to do things that hurt monkeys. And I was like, this is not going to bring us into happiness. This harming these animals will not bring us into happiness. So I didn't come back to psychology and looking for this answer until quite late. I studied at the Institut Catholique de Paris, and there the approach to psychology was very Jungian based, very spirit based. And that opened the doors to transpersonal psychology for me. And depth hypnosis finds its seat in the modern therapeutic environment through the doors of transpersonal psychology, which is a psychological inquiry that includes the investigation of phenomenon with consideration of the existence of spirit, which is antithetical to clinical psychology. So, you know, I think if you're saying what inspired me, suffering inspired me, pain inspired me. and I wanted to find a way to relieve that suffering.
And in the title, Depth Hypnosis, there's the term hypnosis. And where does that fall?
As I mentioned, depth is referring to the deeper levels of the self that one can access. And I use the word hypnosis for several reasons. One is because people living in the mainstream think of hypnosis as something that takes you beyond where you would normally go. And there is a tradition of using hypnosis for stopping smoking or helping people stop overeating. And so I thought it would be a place where people would look for relief. And yet I didn't want to have something that was just, come here and think about this label on something, right? I wanted people to understand that they would be going into another place. And hypnosis helps you get that idea right away, because it is in the mainstream probably the main concept of working in an altered state that there is. I mean, these days meditation has become more known, but when I started with depth hypnosis in the mid-90s, although here in California meditation was known, it really wasn't known throughout the other parts of the country, and certainly not in Europe as a therapeutic intervention. So I was looking for something that provided some information about, okay, we're going to be going into a different place. We're not going to be doing too much, conceptualization just on the mental level. We're going to be working in an altered state, but it doesn't have to be in a kind of prescribed religious way of getting into the altered state, such as prayer or meditation, because I wanted people from any spiritual tradition, including the scientific traditions, to feel comfortable accessing the hypnotic state. So I used that word, hypnosis.
Great. And regression therapy, that's part of depth hypnosis in some ways.
Regression therapy is a huge part of depth hypnosis. And we use the regression work as a way of moving deeply into the self. So once we have worked with understanding the presenting problems that a person has, once we have understood the emotional context in which those presenting problems are arising, and once we have helped a person connect with this part of the self that has only the highest good as its sole intent, then we are ready to use the regression processes as a way to begin to navigate deeply into the self to find the roots of the symptoms that they have come for help with. And so in regression therapy, basically what you're doing is you're going across time. We have a process where we help a person move perhaps into a time earlier in their young adulthood, or perhaps a time in their adolescence, or perhaps a time in their childhood, or they may even be drawn into a time when they were in their infancy, or even when they were in their mother's womb. And we also work with the concept of past life regression, which can be a little bit of a challenge for people who don't believe in past lives. But I always try to encourage people to think about the concept of past lives as an other life. It's an aspect of yourself that you may not be fully connected with. You don't have to believe in past lives, but you just need to consider that there may be another way of understanding what your symptoms are, and a past life experience will give you a very good understanding of a different way to look at the roots of symptoms. So when people move into an experience where they are actually reliving the experience of where they felt traumatized, or where they felt that they were losing a sense of themselves, or losing power, or feeling very interrupted by another person, or feeling like they were absorbing another person's negativity, then we move in again with the participation of that part of the self that has only the highest good as its sole intent, so that they are not just re-traumatized. And we have a process where we help them change their relationship to the event that they're experiencing, so that the charge of that experience lessens, and therefore the power of the symptoms that it's driving also lessen.
And so someone who doesn't believe in past lives can still have an experience of something that is not, say, a memory or a reflection of this current lifetime, and still not necessarily believe that it's a past life, but still work with the information that's coming through.
Yes. One way that I think about it, one way that I talk about it, is I say, you can think about a past life regression as another set of images that are constellating around the same issue, the same energetic pattern that you are experiencing as the issue that you're dealing with in this lifetime. For instance, I remember in one past life regression that I did with someone, this woman came in because she was having very strong OCD. And that's obsessive compulsive disorder. She had been diagnosed by someone else with this obsessive compulsive disorder. So when I asked her, what happens if you can't engage in the rituals that are part of the compulsions that are part of this imbalance, she said that she got very, very upset. And so that was interesting to me, because when she presented in my office, when she presented herself, she was very buttoned down, very, very prim and very proper, very, very controlled, right? And as she talked about this upset, I could see, she was really like, that was going to be a real problem for her if she wasn't going to be able to do her rituals around the OCD. So I said, look, let's just let us go into this upset a little bit as the basis for a regression. I didn't know where we were going to go. You never know where you're going to go. We're always in a state of discovery. So she did the regression. I helped her move into the altered state. I gave her the suggestions to go to the situation, time, or place where that upset first occurred, or most significantly occurred. And she wound up in a situation where she was in a parlor with a young woman and a young man. And they were very definitely in a Victorian parlor. It had, the rounded back chairs and, a gaslit stove and gaslit lamps, and everyone was wearing Victorian clothing. And this was a person who absolutely did not believe in past lives. She was a very scientific, controlled person. So she was surprised to find herself there, right? And she said, I don't know what's going on here, but I'm a man, and my brother, this other man, is my brother, and he's telling me that he and my fiancé are going to get married. And I am livid. So I said, okay, well, let's follow that anger. And she was red in the face, and she was shaking. And I said, well, let's follow that anger. So we followed that anger into, and I said, let's see if we can find a time or place in this lifetime. Let's see if we can do an age regression to this lifetime based on this anger. Because as I said, you can have the same underlying energetic pattern that has different images constellated around it. And you can access the energetic pattern, which in this case was the anger, through the set of images that is in the past life. Now, so we went ahead and we moved into the current lifetime where she was feeling this same level of anger. She was 2 years old, and her sister had just been born, and she was outraged that her sister was getting all of the attention. And so we were able to help that 2-year-old understand things a little bit differently. And there's quite a bit of work to do there in the shifting of perspective. And then we were able to bring her back into conscious mind reality with that whole experience of having gone to a past life and then to the current life through the process of exploring a relationship to an emotion of, it was upset at the beginning, but it was actually anger. And the truth was that she had absolutely no permission to express anger when she was a child, and she was not allowing herself to express anger either. And it turns out that the obsessive compulsive patterns were an effort actually to control the expression of the anger. And because she was so controlled on the mental level, there's no way we would have ever been able to understand the nature of what was behind the compulsion without going beyond the conscious mind, which is what we did. And once she had all of this understanding, we were able to help her work on understanding her anger at deeper and deeper levels, helping her express it, helping her drain all of the pent-up anger that she had had in herself her whole life, because she had been so compulsive and controlling on herself that there was so much experience, which is why she was suffering so much with the compulsions. And as the anger drained, the obsessive compulsive patterns drained. And we would never, and she would have, and she said, I never think of myself as an angry person. I never would have thought that anger was at the bottom of this. And of course, it was by going into the altered state, into the regression process, moving first into the past life, bringing the past life experience into the current life, and then using that information to help shift the experience of, in this case, the anger was traumatizing. She was very traumatized at the birth of her sister. She did not like it at all. So she really came to terms with not only that trauma, but other traumas as well.
What a remarkable story.
Yes.
So what are some of the common issues that you find people are coming in with, and how do you work with those issues in depth hypnosis?
Well, it's interesting because people often come into depth hypnosis for help with relationships, actually. Or they may not know that they have a problem with a relationship, but it always turns out that a problem in relationship is at least tangential, if not fundamental, to the issue that they're dealing with. But people will come for help with understanding, as I say, I specialize in spiritual emergency, but people will often come in for help with understanding how to deal with relationships, especially in the workplace, because they're feeling, upset that they're having a hard time doing their job in the way that they would like to be able to do their job, and they're trying to understand what the proper emotional response is to, say, a boss that may be thwarting them, or a colleague that may be making it hard for them to do their job. And so they want to be effective in the workplace, so they don't want to be burdened with a lot of emotion that they're acting out of, but yet the emotion is there and they don't know how to channel it and get to a place where they can be professional in the workplace. So that's a very common thing that people come for help with. Also, people will often come for help when they've been to a lot of other places looking for assistance. And it's not unusual that people come to depth hypnosis for things like an autoimmune problem or a chronic fatigue issue, some kind of a physical problem that, according to the medical doctors, does not have any kind of physical issue behind it. So they want to understand, what is the issue behind it? If it's not on a physical level, is it on another level? And again, when they think about hypnosis, they think about another level, right? So they'll come for help with that. And then, of course, people come into depth hypnosis for help with phobias and anxiety. That's a very common reason why people would come in for help, because they're having trouble managing fear. And they may not actually even have the word for it. Like, a lot of people who are suffering from anxiety don't even know that fear is related to anxiety. And so they come for help trying to understand, what is this thing that I'm experiencing that people are calling anxiety? They're calling it anxiety, but that doesn't help me. I'm still anxious, right? What do we do about it? And so people come to depth hypnosis for help with and interventions that address issues that are not well addressed in other models.
And how does depth hypnosis approach something like the inner critic?
Well, the inner critic is something that, again, a lot of people don't even know they have. And a lot of people just feel, a little bit depressed or a little bit grumpy, when they've done something wrong, or if they feel like they have failed, or if they feel like they're not good enough, they just feel kind of grumpy. But they don't realize that if they are feeling they're not good enough, or if they're feeling that they're a failure, that there's a part of themselves that is telling them that. Or there's a part of themselves that might be agreeing with someone external to them who is telling them that there's something wrong with them. And that's a problem. So the discovery of this inner critic is actually something that is difficult for people to even know about. And once they understand that if they're feeling blamed for something, there's probably a part of themselves that's blaming them, right? And I will often say in depth hypnosis classes, wherever there is shame, there is blame. And so most people will often just suffer in a state of shame or guilt, thinking that there's something outside of themselves that's causing it. But actually, you cannot feel ashamed if there's not a part of yourself that's not agreeing with someone external to you who is trying to make you feel ashamed or guilty. Or if there's just a part of yourself that's interested in making you feel ashamed and guilty for its own reasons. So the job, of course, is to discover what are those reasons, right? And then, of course, in the inner coming to peace processes, we have a method of dialoguing, setting up a dialogue between those two parts so that they can come to peace, or so that the critical voice can actually be asked to leave.
Fascinating.
Yes.
You said that suffering was one of the things that inspired you to create this model. Can you say a little more about that?
Well, I always feel so bad for people when they're suffering, right? And one of the wonderful things that my studies led me to was this understanding about how suffering is actually something we cause, that we're actually doing it to ourselves. And that was a big revelation to me, because I thought that people were suffering because they didn't have anything to do with it. But the choices that people make, either by omission or commission, generate the kind of experience they have in this lifetime. And when I realized that, oh, okay, well, if people are making choices, then it's a matter of trying to help them understand what choices are they making and why are they making those choices, right? So it was a wonderful thing for me to have this possibility open up, where if we can take responsibility for our experience, if we can take responsibility without having self-blame, we can change what we're doing. If we can take responsibility for the fact that, so for instance, if I could take responsibility for the reason that I'm staying up at night is because I want to tell my neighbor off because they cut down my tree and I don't like that. And then I realize, wait a minute, I'm suffering here because I'm attached to that tree, and because I want to make that person pay I'm attached to making them pay for having harmed something that I'm attached to. So when I discovered this issue around suffering, I actually found a great deal of insight in the Buddhist understandings about the nature of suffering. And when I realized that people could make choices that would diminish their attachment to things, or that would diminish their aversion to things, or that would help them understand how they may have been misconceiving of certain things, then we have a method for helping people come out of suffering. And so a lot of depth hypnosis is looking, where is the person attached? Where is the person avoiding? What kinds of misconceptions do they have? And how can we use the processes of regression, the processes of insight inquiry, the processes of understanding other aspects of experience more deeply in order for them to be able to emerge out of that suffering?
Can you talk a little bit about your studies in Buddhism? And also, I know you spent a lot of time studying cultural anthropology and shamanism, and just how they influenced you personally.
Well, I was exposed to both shamanic practice and Buddhist practice very young, because I was living in Hawaii, which had a large Buddhist community, especially among the Japanese immigrants there. And also the shamanic cultural background of Hawaii is very strong. So I was exposed to both of them early on, but I didn't actually understand the power of these models until I began studying comparative religion in my academic studies. And then I realized, both of these traditions have very powerful ways to help people emerge out of suffering. And shamanism in particular is very catalytic. It's very, it brings a lot of change in a short amount of time. So by combining the Buddhist understandings about the nature of suffering and the shamanic practices for relieving suffering, you have a pretty unstoppable model, which depth hypnosis embodies.
And then there are some of your own processes that you've developed.
Well, I would say all of the processes of depth hypnosis are something that are not necessarily Buddhist or not necessarily shamanic. The whole of depth hypnosis is much greater than the parts. Mm-hmm. And that's not to say that I don't appreciate all of the inspiration from these other traditions, but depth hypnosis is definitely its own thing. And it is constantly revealing itself to me in every session. And I am a student of it as well as a teacher of it.
Fantastic. Well, Isa, it's been a pleasure talking to you today. Thanks so much.
I just want to thank you as well. Thank you for your thoughtful questions and for your inquiry and for all of your interest in helping spread the word about depth hypnosis.
My pleasure.